Let me recognize the gentleman from Kansas, Mr. Estes, to inquire.
Well, thank you, Mr. Chairman, and thank you for all of our witnesses for participating today. I mean, we've got to work on addressing America's mental health crisis, and not just assume that we can ignore it, it'll go away, or allow our county jails to be the repository for individuals who are having an issue. I hope as part of that we'll have an open and honest discussion on the toll that some of the harsh COVID measures have had on the mental health in our society, especially the effects they're having on our children. You know, as we talk about the terrible rise in mental health issues, including cases of anxiety and depression and a rise in substance abuse disorders and suicide, I think it's time we address the fact that many of these measures were clearly causing this issue and have no end in sight. For 2 years, Americans have been subject to rolling COVID measures, which has upended our lives. Protocols which were proposed as only temporary reactions to incomplete medical data are firmly still in place. For example, it's reported that almost 2/3 of large school districts are still requiring students to wear masks. This is despite a much clearer picture today on the risks faced from COVID, as well as the negative side effects to kids from COVID measures like lockdowns, social distancing, etc. I think the staggering mental health numbers show that our children have borne the brunt of a flawed policy process where trade-offs aren't considered and consequences aren't discussed. Anything that drastically alters the routine and normal life for millions of children must be strongly scrutinized to consider the trade-offs and long-term cost. For example, why are children as young as 2 years old still being mandated to wear a mask in many daycares and on airplanes? What does that really accomplish other than to impact their development? But far too often in Washington, complicated and unrealistic solutions are proposed when the simplest solutions will do. The solution here is simple. We need to return kids back to normal. They must be in school without unpredictable shifting COVID protocols that make learning and living unmiserable for them. This is what the American people want. Recent polls showed that 70% think it's time we accept that COVID's here to stay and we just need to get on with our lives. I think parents are rightfully upset at the current COVID policy regime that's being enforced. They're worried about being bullied and canceled for questioning continued COVID measures, even though their children are facing mental health consequences. I fear the current wave of mental health issues that we face today will only worsen if we continue down the same path of never-ending disruptions. Ms. Saucer, in your testimony, you very clearly laid out the impact of caseworker burnout and how the pandemic has caused a rise in severity of cases. Based on the experience, do you believe that the cases and caseworker burnout is exacerbated by the reduced number of mandatory reporters due to some of the school closings and virtual learning? Do you believe that the impact's severe enough that we need open schools so that each children have more eyes on them and have access to intervention early on?
Thank you for your question. And education is not my area of expertise, but I'll do my best to respond to your question. I'll say in Ohio that we have about 600 plus school districts. They're now open, and it does not appear that many, if any, of our school districts will go back to remote learning on a widespread basis. Give credit to our two state departments, Department of Education and Job and Family Services. They did work very closely together when we did have to go remote, and they ensured that between the schools and children's services agencies, we would maintain services to families. We provided laptops so children could learn remotely. We offered pandemic childcare to families. Wi-Fi access was expanded to so children can learn remotely. And in terms of child welfare and the impact on remote learning, we did see a reduction in referral and screening cases in the early part of the pandemic, but a report that we issued last September showed that we quickly began climbing again when schools went back into session this fall. And that we were actually back to pre-pandemic levels when it comes to screening and referrals. So we don't, at least in Ohio, assume that our mandated reporters aren't doing their job. They are. They're making referrals to our county children's services agencies, and we are responding appropriately. I will say the pandemic took a toll on our workforce. While many people were able to work from home, our workforce had to go out into families' homes. They had to do investigations. They had to ensure children were visiting with their families. They were transporting children, et cetera. So they definitely took, the pandemic had a toll on our workforce. Thank you.
Thank you. I'm about out of time. I know we wanted to talk some more about substance abuse and not just opioids, but other such as methamphetamines and others that are affecting us as well. But recognize that's some things we need to talk about. Mr. Chairman, I yield back.
Thank the gentleman. Let me recognize.